in around 2000, you and I had already been here at Wake Forest for a number of years. And you received a call. I don't remember if you remember that call or not, but it was from an outside hospital where they told you they had just had a death, and there was associated with it a high core body temperature. Do you recall that?
I know what you're referring to, yeah. Actually, the call came from our morgue here.
Oh, our morgue.
Yes, it was our morgue, yes. And they said that they had received the body of a young boy who had died an unusual death, but had a history of malignant hyperthermia in the family. And when I went back and looked at my phone records at that time, I found, sure enough, that his father had called, and this young boy had had an episode of malignant hyperthermia, and the father was inquiring about testing and so forth. And I explained that to him and never heard back from him. And so then when I got the phone call from the morgue, I called you immediately, and you and I went over there, and the pathologist gave us a piece of muscle tissue, and Kishko was able to find a mutation from that tissue. That, of course, was the young boy who died playing football, and the one explanation for his death was a stress-induced malignant hyperthermia episode, and that was the paper, of course, that we published.
And after we published that, there have been a number of other case reports or even other series suspicious for environmental or stress-induced malignant hyperthermia episodes.
Right.
Yeah. So what was a disease that was constrained to anesthetic exposure, being the volatile anesthetics and succinylcholine, now has some traction gaining that environmental triggers can trigger this as well. In fact, we've heard anecdotally of other families that have had no testing but had a spontaneous death of a child or a young athlete where the core body temperature was found to be increased at the time, and it was suspicious that the child may have suffered from a malignant hyperthermia episode. Excuse me.
Yeah, in that regard, you know, early on we were telling families that they should not limit their activities or anything else. We didn't want the diagnosis of MH to impact on their lifestyles, and we saw no reason to guard against anything, that they could play football, they could do anything they wanted to, you know. And of course, now that we realize that there can be environmental effects in the absence of anesthetic agents that might trigger this, the cautions that you give the patients differs from what we did initially, and probably goes along the lines that, you know, if you find yourself in a stressful condition due to temperature or something like that, you should avoid that, you know.
So, you know, recommendations have changed sometimes over years or decades in regards to what to do to prevent a disease. So there was a time when dantrolene was prescribed as a pre-treatment, excuse me, before a patient would undergo an elective anesthetic in order to help prevent a triggering of an MH episode.
Right.
We no longer recommend that because we know the side effects of dantrolene include weakness. However, we have now begun to see neurologists and MH experts begin to recommend to families with young children who appear to have recurrent heat stroke episodes, who may be indeed MH susceptible, whether they've been tested or not, to use active cooling as a part of their prevention of a heat stroke episode, either with thermal vests that can keep the child cool in a hot environment, or to make sure that they take both frequent breaks as well as maintain good hydration. So things change over time, and sometimes evidence comes very slowly, or it's just a best practice that clinicians agree upon. We don't always have the evidence we wish we had.
Right.
So.